strong.
Hi, and welcome to Funny Minds. I'm your host, Lynn B.
I'm your co-monster, Mr. Edward Biss. Hello, hello. And I'm going to get the announcement going today because I have the pleasure of knowing these two joining us today on Funny Minds. We're excited. Well, first, I want to start with this. This is a weird call because I cannot see you. So it's going to be a weird call. Yeah, for some reason, my Zoom decided to work except for the video. So this is going to be odd. But I want to start this call by saying big happy birthday to our host, Miss Lynn B. Yesterday was her big birthday.
We did hear you had a birthday, Lynn. Happy birthday.
Thank you. It was a wonderful birthday. I heard from so many people all over up until like 12 o'clock last night. It was amazing. So I had a really good birthday. Thank you.
Awesome.
We're coming off the tail end. Mom, I think, probably pounded a good 4 or 5 hurricanes yesterday. So she's probably a little...
jeez. I know, but, we had beautiful weather.
category 2. But today we want to welcome to the IBN network, which is Insurance Benefit Navigators, 2 of their rock star agents, which is weird for me to say since it seems like about a week and a half ago they were like 10 and 11. But Miss Pearl today and Miss Kelsey Pearl joining us today. Welcome.
Hi there. Thanks for having us, you guys. Honored to be a part of this.
Honestly, it's great. We've had, in the past, we've had Brian on, and Brian is always an interesting, guest.
He's a weird subject. Why don't you just be honest? Brian is weird.
To say the least, right? Yeah.
Yes.
Well, fortunately, they know Brian all too well, so you're not really going to fool them or even, they know the deal.
Yeah,
but
right.
I wanted to get an opportunity to get you on to talk about what you have going on, your roles within the company now. You've been involved in this business now for quite some time, if you think about it. How many years has it been, guys?
So I actually started right out of high school, was even in the office before and, leaving high school. And Eddie probably remembers me messing around with paperwork and trying to answer phones and doing the filing when everything was paper. Now we're kind of in a world where everything's electronic, but I've actually been licensed since 2014. So been slinging insurance ever since. Kelsey was in the industry for a while, got out of it, went into a different industry, and is recently joining us back. So we're happy to have her back. We're trying to get her back on board with all of the fun insurance craziness that's going on in this world.
I think insurance is insane. Any type of insurance. I don't care what it is, whether it's health insurance, car insurance, life insurance, whatever it is. The insurance industry, to me, it just blows my mind.
It is. It's crazy. And even for us, right? Every year we do certifications on this stuff. We nail it down. We've got it memorized like the back of our hand, and then it all changes. So it's like you're never ahead of the curve with this stuff, although we try to do the best we can to stay involved, in tune, certified, so on and so forth. So yeah, it's a crazy world.
What is your mainstay? Like, what are you working on like now? What's the most important thing for you?
So currently right now and fastly approaching, we have the annual enrollment period for Medicare beneficiaries. So that starts October 15th and runs through December 7th. So currently right now, what we're doing is just kind of gearing up for that, trying to make sure that we've got all of our stuff in place, our plan materials. We've got people's attention as far as, hey, the time is fastly approaching. There's a ton of changes that's going on in the Medicare world with prescription drug benefits and just trying to make sure that all of our existing clients and people out in the community and even anywhere in any of the states that we're licensed in are familiar with these changes. So they have ample time to dive deep into those new benefits. And so we can help them make the decision that suits their needs best.
Well, give us an example of what, because there's a lot of people in that category that are going to be watching this podcast. So give us a little overview of what these changes are all about so that they can understand.
Yeah, absolutely. So, of course, most people are familiar with the annual enrollment period, which is that time where you can make plan changes. In years past, everything's been pretty continuous, very minimal changes as far as the benefits go, a couple bucks here or there, up or down on co-pays and out of pocket. But this year, primarily what we're trying to inform everybody on change-wise is going to be the prescription drug plan benefit. Without really getting into plan specifics, we can kind of just touch base on the new rules and regulations. They're removing a phase out of the prescription drug plan benefits, which we see a lot of our folks and clients paying high costs for their medications. That phase is going away. The Inflation Reduction Act is kind of going into place to really help out Medicare beneficiaries more so than harmful changes. But certainly just really kind of looking into that primarily. And then some of the extra things, their dental benefits, the vision benefits, those things we're seeing are being reduced. So if those are things that are important for people, we really recommend, I mean, if you haven't looked over these changes in previous years, now would certainly be the year to look into that. Now is the time, if any at all, to just make sure you're well aware of some of these changes that are taking place.
Well, are you saying that they're going to get rid of the donut hole, or no? That's not what you mean.
That's correct. Yep. The donut hole is going away for 2025. Ooh, so that really? Is a big, yep, that's a big, big change. Or it's referred to as the coverage gap phase, but most folks know it as the donut hole. That is completely being eliminated. So we're really excited to hear that.
Wow, I wish that was on like right now.
Right? I know. It's so funny. I mean, we have so many people that are like, oh, we heard about that donut hole, but that's all they've heard is that that's going away. Not the additional things like, they're putting in an out-of-pocket maximum where people will never pay more than $2,000 for 2025 for the cost of their medication, which is huge. Some of these folks taking these higher cost meds, I mean, they're making a decision of whether they're going to pay their bills or buy their medication. So it's huge. And we're really, really happy that this is happening.
That's really funny because I make a statement every once in a while that, senior citizens, they have to make a decision whether they're going to eat this month or whether they're going to take their medication, which is correct. Really very, very true because, I meet a lot of them in different organizations and stuff like that or senior meetings or whatever. And everybody complains about the same thing. In Europe, seniors are emulated and they get everything and people just really enjoy being with them and giving them and helping them. In America, it's like we don't exist. We're like,
it makes it really difficult, and I see it a lot where we have people that are making those decisions. Are we going to pay our bills? Are we going to buy groceries? Or are we going to be splitting these pills in half to make them last longer because we can't afford to get a refill? It's sad. It shouldn't be that way. It really shouldn't. But, I think with some of these changes based on that Inflation Reduction Act, it's going to help. We've been seeing some rollouts as a result of that the last 2 years, but more so the biggest change taking place in 2025 that is going to be huge for people. So we're really excited to hear about that.
So I wonder on the other end, on the flip side, if the companies are going to be have a large increase in what they're charging, per month. Yeah.
And of course, because, with Eddie, I'm sure you're familiar with Medicare, stuff is very regulated. There's compliance you have to follow. So, without going into plan specifics, we've heard, from our carrier reps with the insurance companies, be on the lookout for the, 2025 first looks and be on the lookout for the annual notice of change, packets. And here they were scaring us to death. Honestly, I was quite surprised when I have seen these first looks and some of these new 2025 benefits. Things aren't as bad as what we were told to expect. So I think that was great to see that we're not seeing huge increases on the cost of the medications and copays since they have eliminated that coverage gap or donut hole, which was very interesting and exciting as well. So I, like you, Lynn, thought, hey, wow, now that these people are only going to be out of pocket $2,000, what does that mean that brand name medication is going to cost now? Is that copay going to be through the roof now? But I was actually quite impressed to see that really wasn't necessarily the case.
Well, I'm looking forward to seeing, how this is all going to play out. Yeah. Because right now I'm in a donut hole. So, the one medication I take is a lot more than what it should be,
Yeah. When you're paying that 25% for some of the cost of those higher tiered, brand name, non-preferred brand medication, specialty medications, it's hundreds and hundreds of dollars. And it's like you say, it's a difference of paying your bills or taking your medication. And most people got to do what they got to do. And then here we go without medication that people need. That's very important. So I will say, specifically in our area, right? We're in, Tri-County area outside of Tampa Bay. So in our area, we were very impressed with what we had been hearing with the changes. We weren't blown away by seeing a bunch of things that were not beneficial to the member versus, what we were told to be expecting,
Okay.
Mm-hmm.
So it was actually quite encouraging.
I said you're in the donut hole with no coffee.
And it's funny.
I don't even like donuts.
And, there's so many other agents and brokers out there. And it's such a, competitive market and industry that we're in. And Kelsey and I did our first, we thought went off excellent. We did our first Medicare 101 or Medicare Basic seminar at a local Italian restaurant here in our area. And we were quite impressed with the turnout we had. I mean, of course, as people are turning 65, they're so confused. They get all these mailers, they get all these phone calls from people and agents from call centers. And, so we decided we're going to do a seminar where these people come, we're going to pay for their dinner. We're just going to give them the 101 and the basics on Medicare was enacted, how what are the different ABCs of Medicare, as I call it, the Part A, Part B, et cetera. And I actually came across a woman, her and her husband, she's going to be aging into Medicare in March. And she told me, she's like, and Eddie, you'll get a kick out of this. She goes, I went to another one of these with another gentleman and you're in competition because he had a really nice butt. And I was like, wow, okay, that's great. So that's why you're going to choose him over us. I got it. So this is a very competitive industry that I'm in, apparently. I need to go and get doing some squats.
Serious competition.
Well, I'm going to be honest. I look at guys' butts too. So I maybe it's a senior thing. I don't know.
So yeah, I guess apparently we got to start getting our squats on, Kelsey.
Yeah. You got to come out in the football uniform pants.
Yeah, exactly.
Really do a little twerking, you know.
Wear our tightest pants possible to really show off the definition.
You start your little IBN glute fest.
Right? So I hoped the fact that we were family owned and operated, had a retail office that this woman could walk into. We've got a bunch of really great 5-star Google reviews. I thought that was enough. No, you got to have a nice butt as well.
You got to have the flow going.
Yeah.
I was in Wally World the other day. Well, I call Walmart Wally World. And I walked in and this lady had this whole big booth set up and she was doing the same thing. I mean, it was wonderful. I stopped to talk to her because it was so interesting and I had a few questions. And she was sitting right there, right at the entrance with this whole big, and she represented every single company and had her laptop there and her cards and everything else. And you could either talk to her there. She would come to your house. I don't know if she had an office. I didn't ask her if she had an office, but I thought it was very interesting to just like throw yourself out there and look at how many people a day come into Wally World. I mean, in
this market, obviously 2 sides of it, right? You've got your call centers that are who knows where, or, they're calling people in areas that they're in completely different states. They're unfamiliar with the market. They're just kind of enrolling, but there's no retention, right? They can't offer the same services that a local agent can offer. So I like that woman. We like to do things that are within our own community, that we're not hounding people on the phones and making them feel pressured or obligated. And we're familiar with the market that these people are in. And we know the doctors. They're like, hey, my doctor's John. We're like John Smith, right? At, so medical clinic. And they're like, wow, so that goes a long way for people to kind of be able to resonate with them, that you are familiar with the market, what they're looking for. And I feel like that helps. So I'm with that lady doing some of your community things and, setting up tables and retail locations. And that certainly does help to really bring in people who are going to know you, see you, know your face, and be able to work with you and retain that business, Well,
it's great that you have an office that people can come into too. So if they're confused about something, they get something in the mail instead of getting on the phone, because a lot of times seniors don't, or they perceive things in a different way. It's better to be face to face. They can come right into your office and deal with all of you guys, and get the information that they actually need. I like that.
And we encourage that. We're like, hey, come on in if you're in the area. Come have a cup of coffee with us. Let's talk. If there's questions, concerns, issues, start with us. And if we can't fix it, we'll get you in the right direction, of who can. So we encourage that. We really do. And I think this, apart from a lot of the competition that we have, is that we do have a retail office. So if you call the office and you can't get us for whatever reason, we're all on the line, or, we've got a busy office, stop on in. I mean, you're going to get us one way or the other, right? So we take pride in being able to offer our services face to face or over the phone.
Yeah, that's great.
Senior market, the senior market's a whole different market,
It is.
And when they start getting into the Medicare, the world of Medicare, and they're so unfamiliar with it, they get just barraged with so much information, good, bad, or indifferent. And I think it's hard for them to navigate through that. And so the twofold, like you said, being able to be familiar with your potential clients.
It's a big deal.
It's about with a brick and mortar where they could come in and inspect your butt a little closer if they want.
Yep, exactly.
It's very to that demographic, very, very important.
I agree. I totally agree. And I think that's the biggest thing. Of course, we're family owned and operated. So, people love that. They come in, they see mom, they see the sisters here, they get a kick out of that. But, just the fact that they can find us here, they stop in to say hello and they're just, yeah. They're just so thrilled. So yeah, that is so true. It is a crazy market, but aside from just the Medicare stuff too, Len, and to kind of circle back around to your question is like, what are we doing to gear up for this busy time of year, or many things. So that's one aspect of it, but we also do individual coverage for individuals and families. So if you're familiar with the individual or the health insurance marketplace, we specialize in that. We have a lot of clients that are enrolled on those plans. So we're gearing up for that open enrollment, which starts November 1st. We've done some community events within our area to gauge interest in people who maybe need our assistance. We like to give back to our community because we are local. We're a small business. We like to interact with the other small business owners. And so, we do community family fun events and things like that. And we had an annual shredding event. It was our second annual last weekend where we had the big Pro Shred truck out and people pulled up and got rid of all their documents, confidential documents that needed to be shredded. So we like to give back to them as well, and had a raffle and food and drinks and so on and so forth. So things like that are really what we do to gear up for these times of years where we're just too busy to do anything outside of the office, but help and enroll and assist people with changes.
And you mentioned a timeline, but I understand that it can go beyond that timeline. If you really have a good enough reason to make a switch in your program, you can go beyond. Yeah, you can go beyond that.
There's, of course, just your traditional, like for Medicare, it's the annual enrollment period.
Right.
For individuals and families, it's the open enrollment period. And outside of those timeframes, if let's say you have some sort of life-changing event, you move, you get divorced, you get married, you have a baby, those sorts of things can always create what's called a special enrollment period for individuals to make a plan change, if they do move and so on and so forth. If you get married, those options, that will change your premiums. It could change your plan benefits. So that is a year-round, what they call special enrollment period, if you do have any of those circumstances that we are able to make changes. Absolutely.
It's funny that you mentioned the area, because I received a letter from my insurance. I'm with Aetna, and I have a Plan F, and I received a letter that it was going up 20%. So, of course, I called them. And in the course of the conversation, the man said to me, if you lived anywhere else but New Jersey, you'd be paying half the amount of money that you're paying right now. Yeah. And I thought that was so amazing that, that because I live in New Jersey, oh my God, it's like I guess the mecca of the world for insurance people or something,
Supplements are obviously, the more costly way to go.
Right.
But that, like you mentioned, it's a great point. Your friend in Georgia may be paying completely different premiums and have completely different options than you would in New Jersey. Same thing with Florida. Every state is different. And it actually, even more so to break it down, every county is different. So, I have people, my neighbor said this and my friend in Connecticut said that. And it's like, everybody is different. Their situation's different. It can literally differ by county. So it's certainly, like I said, you can't go by what someone else has because it's different in every area.
Right.
It all comes to the crunch of the numbers from the actuaries. And that's why it's so, all about population,
demographics, and exactly.
What's the age group of that population? There's so many factors that go into that. What are the big, Katie, what are some of the, and Kelsey's over there, she's like still thinking about the donut.
Kelsey ran off on us. She's so excited about that donut hole that she had to run off.
She had to get a donut.
What are some of the bigger carriers that you're working with now for major medical?
Yeah, so absolutely. So, on the Medicare side, we are with Aetna, Cigna, Humana, United Healthcare, Optimum, Freedom, Simply. We've got most all the major carriers. So also Devoted, they're up and coming company that we really enjoy working with as well. So we are brokers, which means we represent numerous different insurance companies, not just one specifically. On the individual side, you've got some of those same options like Aetna, United Healthcare. There's Ambetter, Oscar, Molina, AvMed, tons of different options, which we are also brokers on that side as well. So when you come in, we're not just looking at one company that's going to benefit us and not benefit you. We're open to whatever works best for your needs, checking doctors, checking your medications, and making sure it's as smooth of a transition as possible.
What about life? Who are some of the big life carriers?
Yeah. So for life insurance, we don't do a whole lot of life insurance. I know Candace, my older sister, who's not with us today, has been more on the life side. Primarily, as a rule, we write with a couple different companies, Transamerica being a big one. We have a company that we're contracted through that we can represent all the carriers and show you all the prices. But the biggies are definitely Transamerica. We've taken on a new one that their rates are really, really good. It's with Catholic Financial Life, and they seem to have really good rates as well. So we've been focusing more so on those two, but our systems and our software allows us to quote and enroll on numerous different companies that best fits the prices that you're looking for.
Okay.
That's
Do you
great
find that you do a lot online too? You know, you're basically an online company also. So,
oh, yeah.
Yeah. So do you get a lot of people asking for quotes online? Which is probably maybe your major business.
Yeah. I mean, aside from exactly, I mean, these days, of course, everything's electronic anyway.
Right.
So all of our systems, we're able to facilitate enrollment. You know, we can do Zoom calls with folks. We can do everything over the phone. Everything is electronic these days. So you don't have, even if you come into the office, I don't have a paper form for you to sign. It's all electronic, which is easier. It limits any type of errors in an application. So processing is smoother. But yeah, we are actually licensed in numerous different states. I know Brian holds licenses, or what they call non-resident licenses, in other states, are primarily my states that I'm in. I'm in Florida, Georgia, Texas, and Tennessee. I've got pretty good, client base in those states. So I saw the need to grow in those areas. But absolutely, I mean, if find yourself in a state other than Florida, or, you need assistance, we'd be happy to help and see if that's something that we can assist with. But we are in numerous other states as well.
So I have a question, and it's personal to myself. If I decide that I'm going to move out of New Jersey, let's say I decide that I'm going to move down by my sister in Georgia. So I can keep the plan I have. I just bring it down to Georgia with me. Is that what it is?
That's correct. Yeah. With the Medicare supplements, you've got some flexibility. So basically all you'd be doing is just updating your address.
Oh, okay. All right.
Yep.
Okay.
Yep. So it makes it easy for you.
Okay. Interesting.
Would they adjust the cost?
So for the supplements, no, it won't adjust. But what you'd want to look into when you do make a move is your prescription drug plan. You want to look into that because those vary by county, by state, et cetera.
Okay.
And those can differ in cost. Yes.
Okay. That's interesting. I think the market is really crazy because I don't understand insurance the way you understand it. I mean, it's like you probably talk about it in your sleep, poor your boyfriend. I feel sorry for him.
Yeah. Unfortunately. Because even at all the family events, insurance seems to come up anyway.
Yeah, I'm sure. I mean, you don't go out to dinner just to have fun. You bring the office with you when you come because you're a whole insurance family, for God's sakes, And as long as I know my brother, I mean, even when he was little, I mean, he was just an insurance freak. So, I mean, so he's in the right business because, it was just always the most important. Golf and insurance. I mean, you can't get any better than that. Okay.
Well, that's true. And they do go hand in hand. A lot of these insurance guys are big golfers. So it goes hand in hand in this industry.
Do you golf?
Myself, no. I actually wouldn't even want to try, but I know I probably should give it a go. But I mean, I've hit golf balls a few times and found that I'm no good at that. So I just stick to insurance. Leave the golf part off.
I tried it once many, many years ago, because my brothers, my father, everybody played golf. The guy I was going to marry, all big golfers. So I said to my dad, all right, let's go to Hillman's and teach me what I'm supposed to do. Well, 5 minutes later, I threw the stick. I walked away. I sprained my wrist. I'm like, you know what? I don't need to know how to play golf.
Enough is enough of this. Yep, exactly. I know. I find myself, like you said, it's like people are like, well, what are your hobbies? I'm like, well, aside from hanging out by the pool, going to the beach and working, that's about it.
Oh,
So, I find that those are, I guess I should take up some sort of sport or whatever, but I'm like, why? This stage in my life, I don't want to break a bone or,
yeah.
I got to worry about my high deductible plan, got to make sure that I don't meet that.
Well, you are an aunt, so you got a little baby to take care of as well.
Yeah. Well, speaking of him, I just had a week with my older sister. She works for us remotely from home. She's on the East Coast of Florida. We're on the West Coast. And I had them in town. She helped us out with our event last night. And we had our second annual shredding event last Saturday. So she's been in town since then. She got in Friday. My nephew, who's almost 2, my sister, myself, all, staying at my place. And I'm still trying to they left this morning. I'm trying to get these nursery rhymes out of my head and all the craziness I had to hear and Thomas the Train. And yeah, it's been an interesting week.
Wait, his favorite song, Who Let the Dogs Out?
That one too. Yeah. Yeah, he's not really talking and saying like full sentences yet, obviously, but he'll point to my Amazon Alexa speaker and he'll say, who, and that's about when you got to play Who Let the Dogs Out.
Oh, that's so cute.
Yeah. He's a trip, I will say. Full-time job.
Oh, yeah.
So, Katie,
yeah.
I was talking to Brian about a whole bunch of things, about homeopathic approaches for people and stuff like that. Talking to him about it, stuff that I've been doing for a while, like IVs and cryo and compression and all these things that they have available to you now that work tremendously. Those IVs are incredible.
Right. I did a lot of that myself.
Those are awesome. And I was talking to Brian about it, just for himself. And, but also to maybe work something like that as far as an event. I think that would be a good grabber for people who want, and just not have it over the top, but maybe have like someone who talks about cryo and someone talks about the IV.
Well, it goes hand in hand with medical insurance, and health and well-being, right? A lot of time, like I found
overall, I mean, you're promoting health and well-being, which everybody should be on board with regardless of your age, but they're very open to that these days because it's becoming more and more popular and people have access to this.
Yep.
And at least my approach with Brian was you could show people that you care about them and you care about their health, not just about their policy and everything
exactly.
else.
Exactly. Right. It's as a whole, right? Yeah.
Absolutely.
And it goes hand in hand. I mean, I actually, believe it or not, Mom actually had some sort of like a cold or a head cold or something. And a couple days go by and I got the same thing she had. And I was down and out, but really needed to get better. So I called a small business. They're a small, a nurse practitioner, and he's got a group of a couple IV techs that are local in our area. I called that same day. By noon that same day, she was out at my house. We did the IV infusion. We did, the Toradol even, which helped with some of the fever and body ache. And the next day Mom was like, I'd really like to do, because within a day, I felt a huge improvement. The next day I called her again. She came right out to the office and hooked Mom up and got her done. So, that stuff isn't covered under insurance, but for the price you pay and need, and it's the whole body, it's definitely all goes hand in hand with, like you say, Eddie, health and well-being. So certainly something that I can agree. I think that's a great idea and something worth looking into, especially since we have a connection with a clinic that does that.
That's very interesting. I mean, and they come to your house too. That's really amazing.
Right to your house or right to the office.
They'll come to your hotel room.
Yep.
I'm
really?
Yep.
Yep.
Wow.
It is really cool. And I mean, you hear about some of these things and you're like, does that really work? And I mean, I'm telling you, literally the next day I was about 90% better. So
what are they actually putting in? I mean, you're getting an IV, and what's in the IV?
It's a lot of vitamins, a lot of different vitamins, things for your immune system. I don't know if you've heard of like a Myers cocktail, which is a big vitamin infusion, which kind of replenishes your fluids. And it helps to boost your immune system to really fight the whatever sickness you got going on and feel better. So yeah, it's great. It's certainly something worth looking into, Lynn.
Wow, that's very interesting. Yeah, Eddie talks about a lot of this stuff, and half the time, sometimes I pay attention, and sometimes I don't really pay attention. Because I just don't. Be honest.
Well, a lot of people, it's kind of taboo to them. They're like, "What do you mean? I just go to the doctor and take a medication," versus the more natural, things that do exist. It's pretty cool.
Yeah, no, I like natural better.
They inject whatever you want in the saline solution. So you get the IV first and foremost, but then you have the option to add, like they'll inject magnesium.
Yep.
They'll inject B12, they'll inject glutathione. Like they do
Yep.
all these things that, you could have added to the, to the IV.
Yeah, that's funny you say that, because
target what
that lady did say that. She had the bag, she got me hooked up. She had the bag of saline. She's like, okay, we're going to do this. She's like, and I can add this, and they inject it right into the bag and then hook it up and flush it through.
Do they give
Yep.
you the idea of, well, here's your symptoms and here's what I would suggest that I
Yes.
put in for you? Okay.
Yep. The lady I
Okay.
worked with did guide me. She was like, here's what we would recommend if you're under the weather, not feeling good. If you're having, fevers or body aches, we can inject a little bit of the Toradol to help with that. And that lasted like 10 hours. I was taking Tylenol, because I had the body aches 10
Right.
hours. I didn't even have to take a Tylenol until late that night to.
Oh, wow.
So
That's
it
interesting.
really is amazing. I'm like you, Eddie. I encourage a lot of people to look into that too, because it just promotes health and well-being and, kind of just keeps you feeling good.
And I know there's a lot of people out don't like needles, and I was one of them. Not a big needle guy,
Right.
but I'll tell you what, it was nothing.
Yep.
It's all administered by an RN. They know what they're
Yep.
doing.
Mhm.
Quick, the whole process literally takes
Wow.
15 minutes. Yeah. If you're super dehydrated, you'll soak it up real quick. Yep. Yeah. I love it. It's a great idea. I really honestly think that's a great idea.
Yeah. And what do you call it? Like, who do you call? Like, what do you look for? What is it?
a wellness spa. Like a wellness spa.
Oh, uh-huh.
Yep. There are a lot of nurse practitioners and even MDs I'm seeing that are just kind of sick of the whole, coordinated care and having to abide by insurance regulations and things that actually keep them from making people well, are finding they're moving to these clinic type settings where they're able to administer these IVs. And, yes, you're cash paying or self pay for these things, but they're able to make people better and help, and they're doing some of the more natural remedies, and it certainly is. It's a good thing that's happening. But yeah, there's a lot of like IV hydration and clinics and things that these doctors and nurses and MD or nurse practitioners will do, and there's a lot more out there than you might think.
That's interesting. I have to look it up.
Mm-hmm.
These professionals are more into this than they are about regular client interaction.
Yeah.
They get practitioners, and these doctors get more excited about the natural approaches and remedies and things that they could do as opposed to pushing pills, which is kind of cool to see.
Yeah, I just always was very, very negative towards medication. So I spent like 3/4 of my life, not taking anything. I mean, even an aspirin to me was like, ugh, I would have to be really, really down and out and sick. At this point to take the I'm taking a medication. It really bothered me at first to go without having to be on medications or take anything. And so doing natural, any kind of a natural type of series of things is really, to me, a lot more beneficial than
I agree.
Most of the medications that are on the market are garbage to begin with. But no, I shouldn't say that.
But no, I mean,
I'll have all the
it's certainly something worth consulting with your doctor on. I mean, and like Eddie said, most of the people that administer these things or doing these more natural, at these more holistic doctors' offices, they've left the ERs, they've left the hospitals, they've left doctors' offices that were just a normal modern day medicine to do this, to live up to their oath, which is like, do no harm, make people better, So they're very skilled professionals.
I think too, in that profession, once you put yourself in those type of scenarios for years and you see so much and you deal with so much, I think you just kind of hit the point where you're just like, I want to help people. I want to make people better, but I can't sit here and look at this shit every day. I give or anything like that a massive amount of credit to be in that environment.
Well, it's a big step. You're going from accepting insurance where people are paying minimal copays to now it's going to be more expensive for the majority of people. Can't afford that. So now you're kind of taking that leap of, okay, now I got to build a clinic around people who are going to be self-pay or so they're taking a big leap there and a big step doing that. Ends up paying off usually.
Could you ever see the industry allowing something like that, to pay for something like that to put on? Because I know they do gyms and stuff like that, now. But
I could only hope that would be the case eventually. I mean, of course, you never know in any industry what's going to happen next year, next week, et cetera. But, I could only hope that something like that, even if they came up with some sort of like reimbursement programming, that would be great. Just as another option or alternative. And I mean, we're seeing some more natural things, like some plans will cover acupuncture now. And there is some more natural things that they're covering chiropractic services, gym memberships, but it's just, it'd be interesting to see. I could only hope that they would go a little bit more that route as well, just to give people the option, but we'll see.
Yeah, you never know.
Well,
you never know.
Like that, then all these doctors and physicians could add that onto their practice and make it one big one shop.
Oh, yeah, then, that's true. A lot of the Medi centers and stuff could have a separate area just for that, which would be good. I mean, they could do it now anyhow, but
at least it would allow them to do both the, traditional medicine and then the more holistic approach as well. But I don't know. We'll see as things change. It gets interesting every year. And I mean, we can only hope that they would eventually allow folks to do those sorts of things if it meant really making it better.
They got to figure out the money.
Yes, it's the bottom line. Yeah.
Let's at least first get through the excitement that they're getting rid of the donut hole. Okay, Eddie?
I know. I'm excited about that.
Yeah, I'm excited. Yeah, I encourage folks, if you take nothing from anything that I've said today, I encourage you to get with us. We're happy to help. Again, we are licensed in other states, but get with us or your broker. We don't want to step on anybody's toes. If you've got a relationship with a broker that you're using, get with them. If you have not looked at your plan in a year, 2 years, 3 years, 5 years, whatever it is, now is definitely the year to look at those options. Things are changing. Not only are costs changing, but benefits are changing. So it's right around the corner. I encourage you to either allow us to earn your business. We'd be happy to kind of offer our services or get with whoever you've been working with, because it certainly is not the year to just say, oh, let it renew automatically and I'll worry about it next year. It's not the year for that.
Have you heard any scuttlebutt, any chatter about the political environment having any type of impact?
So as far as this year, not necessarily, nothing that's impacting. Mm-hmm. What was that, Eddie?
I'm just saying, like, overall, if there's going to be any type of, if you've heard anything, as far as.
So I try to keep the politics out of the business, like face to face with a consumer, right? But I mean, as far as I'm aware so far for 2025, very minimal impacts based on political things. So every year, again, see what's changing, what's happening. But so far from what I'm hearing, there's not anything that's real big and major and needs to be. They had the Inflation Reduction Act and things that are really helping people. Mm-hmm. But as far as big changes of things completely going away and Medicare for all and all that, no impact for 25.
Okay, well, that's good.
I mean, you would never talk picks with a client, but I just figure if you're talking to their agents, maybe other carriers, if sometimes they are, and maybe that trickles down and you guys hear some things, but I guess it is way too early and everything's kind of been put upcoming.
Yeah. I mean, of course, we had a lot of, rumors that people were hearing about the Affordable Care Act or, the Obamacare, as people would call it, going away. And what are we going to do with our coverage? And, this, but that stayed. So, we're just business as usual for 2025 so far.
Okay. So tell us now where everybody can find you.
So we do have a website everybody can go to. It's www.joinibn, I as in India, B as in boy, N as in Nancy.com. So joinibn.com. You can go there. You can set an appointment with one of our agents on there, kind of read our bios, get to know a little bit more about us. Again, it's myself, Kelsey, who had to run. I do apologize for that. Our mother, Suzanne. We have a girl who works for us. She's been here about 7 years. Her name's Maria. And then Candace, who works remotely and handles a lot of our phone, appointments. So any of us are able to help kind of go through the same benefits. We all do the same thing. You can find us online, like I mentioned. You can always give us a call on our office line, which is 727-491-7260. We'll be happy to set up an appointment that way. Or if you are local in the Newport Richey area, feel free to come on into the office. We are actually in Holiday, which is a hop, skip, and a jump from Newport Richey. We're right off of US Highway 19. We got a retail location anchored next to a Winn-Dixie. So yeah, I mean, those are going to be the ways. I would encourage everybody to go to our website. All the details are on there.
And you're going to start a butt tightening video, right?
Correct. Yes. So I expect if you guys invite me back for a podcast, right, I'll let you know how that's going.
Okay.
But no, absolutely. I definitely encourage, go to our website. And again, that was joinibn as in Nancy.com. You'll find all the details on how to find us, what we do, who we are, how to set up an appointment, all that. We also have a Facebook page too. It's Insurance Benefit Navigators. Find us on Facebook, kind of stay in the know with all the enrollment periods, things that we're doing in the community. We post some fun things and pictures on there. So you can always give us a like on Facebook as well.
Well, that's great. And I'm very
Yeah.
happy that you found the time to be with us today and
Hey, I
educate us
appreciate
and
it.
educate our fans. And we do have a lot of fans in that area and people that are coming into that area age-wise. So it's good for
Awesome.
them to be, really knowledgeable about what they have to do. So, anytime they could give you
Absolutely.
guys a call, or if they're in the area, stop in your office and you guys will hook them up with what's going to be the best for them health-wise,
Absolutely. That's our goal. That's our mission, right? We have some core values we stand by, and we think that's what sets us apart. So like I said, feel free to give us a call, find us online, find us on Facebook, and we're happy to take care of you.
Okay. Well, again, I really thank you a lot for being with us. And we are Funny
We
Minds.
thank you.
And if you go on funnyminds.com, you will find that, you could go to any of our platforms and see our episodes. But the platform that we're most pushing is YouTube. So all you guys out there, give us a big heart, subscribe, go on YouTube, subscribe to us. We'd be very happy if you would. And of course, on our website, we have a store and we have our merch. We have,
Nice.
we have shirts with a lot of different Funny Minds logos on there. And we have mugs and, everybody's got to have merch. So we have it too. So
That's great. Yeah, that's great. Interesting. I'll go on there and have to get myself a little coffee cup.
yeah.
And 420 friendly.
And yes, we are that too. And also there's two organizations that we're very proud to be aligned with, and that's St. Jude's Children's Hospital and breast cancer. So if you go on, there's a big purple button on there. If you'd like to make a donation, that would be wonderful. If not, still go on our website and see what we have on there.
That's
so
awesome.
Again, funnyminds.com, Lynn B, Eddie, my host, we love you. And we always say to everybody, be happy, be healthy, be wise, and laugh, because we all know that laughter is the best medicine. And we're going to say goodbye now. And
bye, you guys.
again.
Thanks for having me.
Okay, take care.
Talk soon.
Take care. Bye-bye.